Have you ever wondered if your bald spot could be telling you something about your heart health? Recent research suggests that losing your hair, especially on the crown of your head, might be linked to a higher risk of heart problems. This connection between baldness and heart health could be a warning sign for many. Before we go any further, when did you last check your cholesterol levels? I would appreciate your comment, just for comparison. I check that around every 3 months. I do take all healthy lifestyle choices, but also take cholesterol-lowering drugs. In simple terms, the blood vessels that take blood to your head may be narrowed by cholesterol. Your hairline might be more than just a cosmetic concern. It could actually be signaling what's happening inside your body, particularly with your heart and blood vessels. Hair loss is very common among men. About half of men notice their hair thinning by the time they reach their 50s. By age 70, around 80% experience some degree of hair loss. However, not all hair loss has the same health implications. Let's talk about what researchers have discovered. Japanese scientists found that men who were losing hair from both the front and the crown of their heads had a 69% higher risk of having a non-fatal heart attack compared to men who still had a full head of hair. This is quite a significant increase in risk. But it's important to understand that this doesn't mean baldness causes heart problems. It simply means they might share some common underlying factors. Wait, there is more, but do not forget to hit the like button if you think this video is useful. A study involving Asian Indian Gujarati men found that among those with coronary artery disease, 37.7% had androgenetic alopecia, which is the medical term for male pattern baldness. In contrast, only 20.7% of men without heart disease had this type of hair loss. The researchers calculated something called an odds ratio of 2.70, which essentially means that men with male pattern baldness were about 2.7 times more likely to have coronary artery disease. The connection was even stronger for men with more advanced hair loss on the crown of their heads. Another large study called the Physicians' Health Study followed more than 22,000 male doctors over 11 years. They found that compared to men with no hair loss, those with mild vertex baldness, meaning hair loss at the crown, had a 23% higher risk of coronary heart disease. Men with moderate vertex baldness had a 32% higher risk, and those with severe vertex baldness had a 36% higher risk. The pattern is clear: more hair loss at the top of the head seems to be associated with a greater risk of heart problems. Why does this connection exist? Scientists aren't completely sure yet, but they have some interesting theories. One common explanation involves male hormones, particularly testosterone and its derivative, dihydrotestosterone or DHT. Men who are bald often have more androgen receptors in their scalp and higher levels of these hormones. These same hormones might also affect your heart and blood vessels. Interestingly, the location of your baldness matters a lot. A receding hairline alone doesn't seem to increase heart disease risk very much. But losing hair on the crown or top of your head does appear to be linked to higher heart disease risk. The British Heart Foundation advises that men should focus more on their waistline than their hairline, but the research suggests that your hairline, especially at the crown, could be giving you valuable health information. The connection becomes even stronger for certain groups of men. If you're bald at the crown and also have high blood pressure, your risk of coronary heart events is nearly 80% higher than men without these conditions. But even more striking, if you have vertex baldness and high cholesterol, your risk could be 2.78 times higher. That's nearly triple the risk. This is why checking your cholesterol levels becomes especially important if you're noticing hair thinning on the top of your head. Your body uses cholesterol for many important functions, including building cell membranes and producing hormones. See the video above for 10 ways to lower cholesterol and triglycerides naturally. But when you have too much cholesterol in your bloodstream, it can build up in your arteries and form plaques that restrict blood flow to vital organs, including your heart. This condition, called atherosclerosis, can lead to heart attacks and strokes. Regular cholesterol screenings are important for everyone as they age, but these findings suggest that men with male pattern baldness, particularly at the crown, should be especially vigilant about getting their cholesterol checked. A simple blood test can measure your total cholesterol, HDL or good cholesterol, LDL or bad cholesterol, and triglyceride levels. This information can help you and your doctor assess your risk and take appropriate steps if needed. There's a bit of a twist in this story though. While high cholesterol in your bloodstream is associated with heart disease risk, cholesterol actually plays an important role in hair growth at the local level. A recent 2025 study found that cholesterol can promote hair follicle stem cell proliferation through certain pathways involving the sympathetic nervous system. This might sound contradictory, but it highlights the complex relationship between cholesterol and hair growth. Systemic cholesterol levels in your bloodstream and local cholesterol metabolism in your skin may have different effects. If you're already dealing with hair loss, there might be an unexpected benefit to one common treatment. Finasteride, a medication commonly prescribed for male pattern baldness under brand names like Propecia and Proscar, may actually help lower cholesterol levels according to recent research. This drug works by preventing testosterone from converting into dihydrotestosterone, which is the hormone that shrinks hair follicles and leads to male pattern baldness. A study published in early 2024 found that men taking finasteride had lower cholesterol levels than those who weren't taking the drug. The same effect was observed in mice, where finasteride reduced cholesterol, delayed atherosclerosis, and lowered liver inflammation. But this doesn't mean you should start taking finasteride just to lower your cholesterol. More research is needed to confirm if this effect is significant enough to be used specifically for cholesterol management. The drug also has potential side effects that need to be considered. Always talk to your doctor before starting any medication. So what should you do if you're noticing your hair thinning, particularly at the crown? First, don't panic. Having male pattern baldness doesn't guarantee you'll have heart problems. But it might be a good reason to be more proactive about your heart health. Schedule a checkup with your doctor and ask for a cholesterol screening. Also consider other risk factors for heart disease that you might have, such as family history, smoking, lack of exercise, or being overweight. Your doctor can help you interpret your cholesterol results and recommend lifestyle changes if needed. These might include eating a heart-healthy diet rich in fruits, vegetables, whole grains, and healthy fats. Regular exercise is also important for maintaining healthy cholesterol levels and overall heart health. If your cholesterol levels are very high, your doctor might recommend medication. Remember that baldness itself isn't causing heart disease. Both conditions likely share some common underlying factors, possibly related to hormones or genetics. Think of your hair loss as a potential early warning system that gives you the opportunity to check and address any heart disease risk factors sooner rather than later. Many men feel self-conscious about losing their hair. But perhaps knowing that it might prompt them to get important health checks could give a small silver lining to this very common condition. After all, baldness is often considered distinguished looking, and being proactive about your health is definitely an attractive quality. The connection between baldness and heart health reminds us that our bodies often give us subtle signs about what's happening beneath the surface. By paying attention to these signs and taking appropriate action, we can take better care of ourselves and potentially prevent more serious health problems down the road. A simple cholesterol test might not bring your hair back, but it could give you valuable information about your heart health and help you live a longer, healthier life. So if you're noticing more hair in your brush and less on your crown, consider scheduling a cholesterol check. Your heart will thank you, even if your hairline doesn't improve. Your bald spot might just be saving your life by prompting you to get this important health screening. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. See you in the next video.